Today, we're diving into something that's, both super common and surprisingly complex: infant hydration. It is a science where literally every single drop counts, and getting it wrong can have some pretty serious consequences. Okay, let's get into it.
So, you might be thinking, what's the big deal? Isn't it just about making sure a baby gets enough to drink? Well, the answer, as we're about to find out, is a definite no. Managing an infant's fluid intake is, truly, a medical high-wire act.
And it all comes down to a really simple but profound fact. Infants are not just miniature adults. Their little bodies work in ways that are fundamentally different from ours. Their fluid needs are incredibly specific, they have to be calculated with amazing precision, and, get this, they can change in the blink of an eye.
To really wrap our heads around the stakes here, we're going to start with the most vulnerable of all: premature infants. For them, hydration isn't just a challenge, it's managed on a knife's edge.
So what is it that makes these tiny patients so fragile when it comes to fluids? Well, there are three big reasons. First, their skin is unbelievably thin and porous, which causes huge amounts of invisible water loss. Second, they get cold very easily, which forces their bodies to just burn through energy. And third, and this one is huge, their kidneys are seriously underdeveloped.
To really get that kidney issue, we need to know a key term: glomerular filtration rate, or GFR for short. All it really is a measure of how well your kidneys are filtering your blood. A higher GFR just means your kidneys are working more efficiently. Simple as that.
And what's just staggering is the sheer scale of the difference. A preemie, born at 28 weeks, has a GFR that is just 10% of what a full-term infant has. 10%. That means their ability to process fluids and get rid of waste is just a fraction of what it needs to be.
So this creates a massive dilemma, right? You can't overload them with fluid because their little kidneys just can't handle it. But at the same time, they're constantly losing water. The only way forward is a super careful, calculated, steady increase. Let's take a look at what that actually looks like in practice.
Okay, so on day 1 of life, they start with a baseline of 60 to 90 milliliters of fluid for every kilogram of body weight.
Then, every single day, that amount is bumped up by another 20 to 30 milliliters per kilogram.
And just look how fast this happens. By just day 5, the target has more than doubled, all the way up to 150 to 180 milliliters per kilo. This rapid but incredibly controlled increase is absolutely critical for their survival.
All right, so that's the high-stakes world of preterm care. Now let's switch gears and look at the baseline for a healthy, full-term baby.
For a healthy term newborn, the magic number is right around 150 milliliters per kilogram of milk each day. Now, to put that into perspective, that is the equivalent of an adult drinking 15% of their own body weight in fluids every single day. That's a huge amount, relatively speaking.
So how do doctors figure this out as kids get bigger?
Well, they often use this really clever but simple formula, sometimes called the holiday cigar rule, or just the 150-20 rule. It's basically a tiered system. You give 100 milliliters for each kilo for the first 10 kilograms of weight, then 50 milliliters per kilo for the next 10, and then 20 milliliters per kilo for everything after that. It's a real cornerstone of pediatric care.
But, those formulas, they're just the starting point. In the real world, things are almost never that straightforward. A whole bunch of factors can suddenly change what a baby needs and introduce all sorts of new risks.
So why are babies so prone to dehydration to begin with? It goes right back to their unique physiology. For one, their bodies are made up of a higher percentage of water. They have a much faster metabolism, and they have a larger surface area compared to their size. All of that just means they lose fluids way, way faster than adults do. And this is where it gets super relatable. Think about this. Something as minor as a stuffy nose can make it hard for a baby to eat, and that alone can be enough to tip them over into dehydration. It just goes to show how fine that balance really is. And of course, the risks get even bigger with more serious problems. Any kind of acute illness, a surgery, or an underlying condition like a congenital heart defect. All of these put tremendous stress on a baby's system, and that just skyrockets their need for both fluids and energy.
Which brings us to the crucial science of rehydration. See, when a baby gets dehydrated, fixing it isn't as simple as just giving them water. It is all about giving them the right fluid at exactly the right pace.
And this is where a correct diagnosis is everything. I mean, look at these two emergencies. On one hand, you have hypovolemic shock, where the body has lost a ton of fluid. The goal here is speed. You give a fast, large bolus of fluid to get their circulation back to normal.
But on the other hand, you have something called hypernatremic dehydration, where sodium levels in the body are dangerously high. Here, the goal is the complete opposite. The correction has to be slow, done over 48 hours or more, to avoid the catastrophic risk of the brain swelling.
So what this means is that if you treated the second condition like you treat the first, the result could be disastrous. It just hammers home why precision in diagnosis and treatment isn't just best practice, it is quite literally a matter of life and death.
So as we've seen, this whole field is just a masterclass in precision. From that tiniest, most fragile preemie fighting for every gram, to a toddler who just has a common bug. Every single drop of fluid they get is part of a complex, careful, scientific calculation.
And that kind of leaves us with one final thought. We've been focused on hydration, right? But that's just one tiny piece of the puzzle. What does this delicate, incredibly high-stakes balancing act really tell us about the remarkable, intricate, and just awe-inspiring science that governs that first year of life?